Harjit Singh Bhatti. He is the Doctor of Internal Medicine and National President of Progressive Medics and Scientists Forum. Thanks so much for being with us. We appreciate it. First, I think it's slightly unfair, to present these numbers in non-per capita terms. India has a population of over 1 billion people. So its COVID-19 fatalities per capita are actually just a fraction of European countries, for example. Still, should India be worried?
Yes, India should be worried because the first thing is that the way the number of cases are rising is actually worrisome. And second thing is that India's healthcare system is not that much equipped to tackle large number of patients at a particular moment of time. Because India's healthcare system, specifically the public healthcare system, is don't have a strong infrastructure or don't have the required number of manpower. So yes, we are worried because the way the number of cases are rising. So we are expecting that the healthcare system will be overwhelmed and the manpower will be exhausted. So this will result into more severity in form of casualties.
Okay, so do you think India should have kept that lockdown in place, even though the lockdown was very much to the detriment of millions of poor, particularly migrant Indians that were left stranded and some even starving? Still, do you think the lockdown would have been better for the country and for the greater good?
Lockdown has done one very important thing, and that is that the lockdown has delayed the peak. Means otherwise, if the lockdown was not imposed, then we might have seen the peak much more earlier. So it has definitely saved people from getting infected. But if we say that lockdown itself will solve the problem of coronavirus, is like underestimating the virus. So this is what the mistake done by the policymakers, because they thought that just by imposing a lockdown everything will be solved. But the issue came is during that lockdown time, there must be more testing must be done, and apart from that testing, they have to be isolating more patients and then trying to break the chain of transmission. This is what required in during the lockdown period. But that active intervention or going behind the virus and isolating patients and breaking the chain of infection, that approach was not taken, and just a strict lockdown was thought as a treatment or a remedy to the coronavirus. So overall, lockdown definitely delayed the peak for certain amount of time. But otherwise, if we say that whether we have any benefit in terms of decreasing the number of infections, or we are able to flatten the curve of infection, that ultimate goals was not achieved by lockdown.
Okay, but during the lockdown, was there, I mean, they did buy some time, in fact, to improve the health
Yes.
infrastructure that you were saying won't be able to manage an influx of cases. Was anything done to improve health infrastructure? Have materials, basic supplies been bought? Will they be provided for if there is another surge?
The government was they are trying to now build a more infrastructure, like the railway bogies was converted into hospital beds, and even the PPEs was made at very large number. Apart from that, they were also there saying that the now the PSUs, the public service units, they are manufacturing ventilators, and all even the hotels, like hotels were also converted into hospital beds. So overall, government is trying to build a more infrastructure and accommodating more and more patients. But still, the India's population is so large. And the second thing is there are so many people who are living in slum areas, or there are so many people who are in the containment zone, and a single infection can result into infection to many people. And second thing is now, because we have eased the lockdown, this easing of lockdown and opening of economy, now even the opening of monuments and all the other shopping malls and other areas, so we are expecting a large surge in infections. And to to accommodate that large upsurge, our infrastructure is still very limited, and I am not seeing that with such a limited infrastructure we were able to tackle such a large upsurge.
Okay, Harjit Singh Bhatti, thank you so much for being with us. We appreciate it.